facility protocols for tracheal suctioning. Review the patient's chart for general consent, specific orders for frequency, depth of suctioning and oxygen administration, allergies. Obtain appropriate assistance for the procedure if it's needed.
So at this time, I would ask someone to be able to assist me in order to later on remove the oxygen source and be able to bag mask the patient before suction begins.
In your hands, and then you'll introduce yourself and identify the patient with 2 written identifiers.
So that's when you're going to take the chart in there to the bedside, knock on the door, knock, knock, knock. Hello, hello, and I am Christy. I'm going to be your nurse today. We are needing to do some suctioning on you. The doctor has ordered, plus you got a lot of secretions in there. So I just need to check and make sure that you are who you are. Look right here, okay. And you're looking for the patient's medical record number, and you're also looking for their name, and it's who that is. So you are John Smith. Okay, Mr. Smith, and I'm gonna go get my supplies and things, and I'll be back, okay?
All right, so you gather your equipment, the towel or drape to protect the patient's chest,
The towel.
mask with face shield, if body fluids are anticipated, suction catheter kit, your sterile saline solution, oral care supplies, wall suction source,
Which will be in the room, and I will show you when I enter the room.
and your bag mask device that's
And-
attached to oxygen.
And I will show you the bag mask when I enter the room.
Now you'll go into the room, explain your procedure to your client, provide their privacy, and position them in Fowler's.
So what I'm doing is I'm getting the table set up so I'll know, so I can actually reach and not be contaminating as I go back across. Now, as I've said, you'll have a bag mask. The bag mask will be normally up here at the top, but I'm putting it on the other side of the patient so that my assistant will not be in the way, so they can actually take this and bag the patient in just a little bit, okay? Also, the oxygen that's right here, my assistant will take this and move it to the side with gloves on. All right, so I'll be able to do the procedure that I need to do.
At this
All right.
time, you'll go ahead and you'll assess the respiratory status, shortness of breath, coughing, respiratory rate, skin color, breath sounds, heart rate, rhythm, or O2 sat. Remain mindful of the heart rate and O2 saturation during the procedure.
So at this time, you can listen to the lungs. You will assess the heart rate, or you will verbalize the heart rate was this. You will verbalize that you have done all those things and that you've checked capillary refill, heart rate, blood pressure, and the patient is safe to have suctioning done.
Then you don your mask with the eye shield. Lift their chest with the towel.
All right, I'll drape this across you.
Turn your suction source on to the continuous suction at 100 to 120 millimeters. Do not exceed the 120.
And you get the dial to the one, say about 100.
Set the O2 flow meter that's connected to the bag mask to the highest flow rate.
And then this right here will inflate normally, so you would know that you are where you're supposed to be.
Clean your hands. And you'll open your sterile suction kit.
Okay. So I've made sure that I had all my supplies in the room and that I've got my suction ready. The patient knows what I'm going to do. And you're thinking right now that, okay, if I got everything the way I need to do it. Then you're going to open up your kit. And you'll take this and dispose of it in the garbage. Now, this right here, you can touch the outside rim only, and you open it up. You do not want to touch the inside because that is considered a contamination. You set it aside back here.
Go ahead and fill with your sterile saline.
Then you take the sterile saline and you pour it in. And then you set it aside.
Now you'll go ahead and don your sterile gloves.
Now the sterile gloves, just make sure when you're doing this to actually open them up and bend back every single individual fold so it won't flip back on you. See how I'm pulling right here? That way it won't open up again. Okay. At this time, you can either use the gloves that are in the kit, but the gloves are a little too small for me, so you would remove these gloves and dispose of them. Okay? I will then move this to the side right here, and I would take my sterile gloves. And if you didn't have room on the table, you could do this, open it up on the chest, but just be careful not to contaminate. Again, you see how I'm opening these just like this and kind of folding them. Now you have the creases up here at the top. You really want to make sure that you bend them backwards. Also down here at the bottom. Because when you open it up, it won't flop back on you, okay? So you won't have a contamination. Now, you know when you're putting on gloves, you got to touch right here on the outside and put your hand in not to contaminate. And if the glove doesn't go on right, just like this, you can fix it in just a minute. Slide through the other side. Hold on. Now, once you have the gloves on, you can fix them the way you need them. Now, sterile gloves, you need to keep your hands right up here, okay? Do not drop them below your waist, because if you do, you're probably going to contaminate at this time. Now,
At this time, with your sterile dominant hand, pick up your suction catheter, maintaining it in a loop as best you can.
okay, so this is my dominant hand. You have to get into the kit.
Hold suction tubing with the non-dominant hand, which will no longer be sterile, and you will connect the suction catheter to suction tubing, maintaining sterility of that dominant hand.
So while you have it here, you can curl it the way you need to. Okay, do you see how I took my hands and I just curled it while it was in here on the sterile paper? You have it here, and you are ready to hold this piece right here to connect. So this is the dominant hand. You can position the table with your leg to move it out of the way a little bit. Okay, so this hand is still sterile. This hand is this hand is my sterile hand because it's my dominant hand. This hand is about to be non-sterile, okay? Because I'm going to take the suction, connect it to this so we can actually do the suctioning for the trach.
And you'll suction a small amount of saline through the suction catheter to test the suction and lubricate the catheter.
Okay, so you see how you have, this is the suction mechanism right here, the little green part. And that's what, when you put your thumb over it like this, that's what's causing the suction. So you'll take this into the saline, hit it a few times, and saline will come up into the tube, and that way you know it's working properly and it's lubricated.
If the client has a trach, remove the O2, have the client deep breathe and cough. Have your assistant hyperoxygenate the client with a bag mask, administering 5 to 6 breaths over 30 seconds.
So at this time, this is when I had gotten the assistant earlier. She's going to remove the O2 to the side. Can you please take a deep breath and cough? Now realize in real life when this is happening, secretions can come flying, so that's why you have the face shield on at this time. She now will attach the bag mask and she will breathe for the patient. Now, during all this time, you got to watch for these patients to make sure that they're not desatting, because it may be that it is not working at the time for them to be getting enough oxygen without having the oxygen on itself. So now that she's done bag mask,
Avoiding contamination, hold the suction catheter like a pencil and introduce it into the trach tube until the prescribed depth or resistance is met, about 6 inches.
okay. So the one thing to really watch with this is when you're inserting this as a pencil, you got to make sure that you do not drop your wrist onto the patient's chest, because that is a contamination. So you take the pencil, you enter in.
You do not apply suction as you insert the suction catheter.
Okay. Then once you reach to about right in here, the patient's going to start coughing.
You withdraw the catheter slightly, then apply suction continuously, but for no more than 10 to 15 seconds.
2, 3, 4, 5, 6,
Gently
7, 8,
twist
9, 10.
back and forth as it's withdrawn completely, taking care not to contaminate the catheter. At this point, you can hyperoxygenate the client again and allow their oxygenation to return to baseline.
So right now is when you would say, I need my assistant to please bag the patient. And all this time that you're watching the patient to make sure that, that they're staying pink and rosy and their sats aren't dropping, and you kind of monitor their vital signs, okay?
You can rinse the catheter with sterile saline again.
Okay.
Repeat the suctioning and the hyperoxygenation and rinsing the catheter if it's indicated and if the client tolerates. You will then reapply your client's O2.
So you ask your assistant to reapply the O2 once you're done suctioning.
Disconnect the suction catheter from the suction tubing. Grasp the cuff of the sterile glove. Pull the glove down over the used catheter. Discard catheter in both gloves. You will then clean your hands and apply new, non-sterile gloves.
Okay, cleansing my hands.
Provide oral care at this time.
So I got in my oral kit earlier. We'll open it up. Hello, Mr. Smith. I need to clean out the inside of your mouth. Can you open your mouth for me, please? And then you clean inside the mouth and around the teeth. Then you take the swab and you dispose of it in the garbage.
Then remove your gloves, mask with eye shield, turn off your suction and your O2 supply to the bag mask.
Okay. All right. Suction is off. Oxygen is off to the bag mask.
You reassess the client's respiratory status. Has their shortness of breath improved, their coughing, respiratory rate, etc.
Then you would assess the patient, listen to their lungs to make sure that everything sounds okay.
Clean your hands. And then document the color, amount, odor, sputum suction, breath sounds, patient's tolerance to the procedure. And you have just scored 50 points.
And then it will be done. Y'all can get it all your points and everything will work out great.